The Dr. Taz Show, the podcast. Dr. Taz, Superwoman Wellness. Here's Dr. Taz.
Welcome back, everyone. Welcome back to another episode of Superwoman Wellness, where I am determined to bring you back to your superpower self. Joining me today is a guest who is going to do exactly that. I have with me Dr. David Steenblock. He is an interdisciplinary medical genius, taking roads untraveled to find the ultimate healing for his patients with a focus on stem cell therapies. I am so excited to learn more about this. I enjoy studying, he says, from his private library with an amassed collection of just over 60,000 medical books and millions of research papers. I'm always looking forward. What is the greatest thing that we can do which hasn't been done yet? And Dr. Steenblock does just that. He has used stem cells to significantly heal patients suffering from ALS, Alzheimer's, dementia, chronic pain, strokes, and traumatic brain injury, along with heart disease and cerebral palsy. Welcome to the show, Dr. Steenblock.
Thank you so much for having me. I appreciate it.
Well, we are thrilled to have you here, and I love speaking to forward thinkers, people that are pushing the envelope, pushing things beyond what's comfortable, and really trying to change humanity, quite honestly. And I think you're one of those people, so it's such an honor to have you on here. I want to know how you became interested in stem cells to begin with. It's an area, I've got to be honest, that I don't know a lot about. We don't offer it in our clinic. I'm fascinated by it, but don't have the time to dive into it. So tell us a little bit about it and how you sort of latched onto that idea as sort of the next thing to move us forward.
Well, the 1990s were the year of the brain. And so I spent that 10 years working with brain injury patients, stroke patients. And I started the first hyperbaric oxygen therapy center for stroke patients in the world, and along with standard conventional physical therapy, occupational therapy, and speech therapy. And we did things like acupuncture, and we did all kinds of other things along with the hyperbaric. And we were always trying this, trying that, trying to see what else would work better. And after 10 years, we were still having patients that didn't get as well as they wanted to. And they kept asking me, what else, doctor? What else can you do? And so I was looking to help them. And then I'd been reading a little bit about stem cells, and I came across a place where I could actually get some and try it. So I bought some stem cells and we started treating. And before I started treating the stroke patients, I didn't want to do that because I didn't know whether or not I was going to do anything, because it was new, never been published, and nobody published anything at that time. Animal work, but not human. And so I decided that what would be the most low-hanging fruit, they call it, the patients that are most suited for it, the ones that are most apt to get better. And it turned out that I came up with cerebral palsy. Because cerebral palsy is a disease like a stroke of the newborn. And the only thing is that they haven't got all of the assorted different diseases that the older stroke patients have. They don't have heart disease and hypertension and cholesterol problems, et cetera, et cetera. And so they're fresh, they're young, and they have a lot of growth factors. And that helps the stem cells grow too. So we decided to start giving stem cells to cerebral palsy patients in Mexico, just because of the regulatory authorities here were not about to let us do anything. And so we did that. We did the first clinical trial, and it was successful. We had about an 80% success rate in terms of overall significant improvement. And with that, we then started doing other kinds of cases and whatnot. And so it's just one thing after another after another.
Wow.
By 2006, I was doing bone marrow treatments. And by 2010, we were doing umbilical cord, bone marrow, and fat stem cells. So we're doing and have been doing a lot of different stem cells. We're probably up to 10,000 patients now.
That's amazing. But so for people who are listening and they don't even know what a stem cell is or how a stem cell works, what would you tell them? How would you explain the concept?
Like a seed. You have a seed in the garden and you plant it, and it starts off with this little tiny thing. You say, what's that? That's just who cares? But you put it in the water, you put it in nutrition, you give it sunlight, etc. And pretty soon you have a plant and a little bit later, maybe you have an apple or an orange or something. And so it's that same kind of thing. The seeds, unlike that seed that's so specific, a stem cell can grow into an orange, an apple, a pear, any kind of a tree, any kind of a plant, because it has a number of different ways of developing. And so the environment tells it where and what it should do. So if you plant it in a forest, it'll become a tree. If you plant it in a garden, it'll become a flower. So if you plant it in the brain, it becomes like a brain cell. If you plant it in a muscle, it becomes a muscle cell, that kind of thing. So, and the cells, when you put them into the body, they circulate in the blood and they go to wherever there's an injury. So this is our body's way of repairing our cells. So it's the entire genetic code that you have in your body, in that cell, and it goes to wherever it needs to be, and it plants itself there and restores not only the cell around it, it helps with growth factors that help stimulate the repair of the cells, but also has the perfect genes that if there's damaged genes, it helps repair and replace those damaged genes too.
Got you. Okay. And there's a lot of debate that I've heard, and I've had some really tough patients that have gone to different stem cell clinics throughout the country and even internationally. How do you know you're getting good stem cells versus not so great stem cells? How are they screened? How are they regulated? What's sort of all of that hubbub about?
Yeah, that's a monstrous problem. Up until about 5 years ago, I really had no competition because I had my own stem cell lab for many years. There's about $800,000 investment, and so with that you can do microbiology tests, you can do endotoxin testing, you can look at the cells under the microscope as they're growing. If there's any contamination, you can generally see if there's bacterial contamination, you throw it all out. And then when you start with, you test the viral studies and whatnot on the original umbilical cord. So that's all done before you start too. Now, going on to the other people that don't have their own stem cell lab, and they're buying from stem cell manufacturing. I'm not sure how many there are, maybe 20 different companies that are selling stem cells to the doctors around the country. And you never know what you're getting. Some of the guys are good, some of the people are great in terms of doing whatever they can to make it right, and they have enough money to do it. And others are operating on a shoestring, and they're trying to get by with as little as possible because they don't have any money, and they're trying to make money to have more money to buy more equipment. So 3 or 4 years ago, it was awful. We had one case after another where people be receiving stem cells and they'd have allergic reactions because they were taking the umbilical cord and some fresh umbilical cord, and they would put that into their hood where they can do sterile operations, and then they would grind it up and put the whole cord, ground up cord into different vials and sell it as stem cells. So you'd be getting, and the wall of the umbilical cord, the blood of the umbilical cord, those cells are all different, and they're different from you, and they give you allergic reactions. So we had a lot of that stuff going on. It probably still is, but over time, either the FDA has gone after them, or they have been chased out of business for doing that kind of thing. I was talking to, about 2 years ago, I was talking to the leading guy in stem cells up in San Francisco. He was giving a lecture down in San Diego, and I went up to him and said, so and he's using these kind of cells. And I said, do you give corticosteroids with every shot of stem cells? Oh, yes. And the reason for that is because it mitigates the side effects of the stem cells that he was buying. But I've never had that because I don't have these side effects.
Got it. Interesting. So how is the consumer supposed to know?
Unless you come to me, I don't know. You have to find a doctor that actually has his own lab and do it. Otherwise, you can't. Or the doctor is very, very careful. Ask first of all, does he have a microscope?
Yeah.
Number one. Number two, does he look at the sides? Does he do endotoxin testing? They do microbiology tests.
Right.
And it goes on and on. But in general, then they sell you. For example, they'll sell you on 30 million stem cells for $10,000, okay, or $3,000 or $5,000, whatever. and you get the get those stem cells from that company, and they say 30 million, and we measure them, and it's 3 million.
Mm.
You know, unless you have a flow cytometer like I have, you can't know whether or not these people are telling you the truth. And
Got
so,
it.
you know, there's so much bad medicine going on now. It's, you know, it's amazing that anybody's not, you know, well, some people have died and some people have been injured, and so we want to try to prevent all that as much as possible.
Absolutely. So yeah, that's the part that has not scared me, but like I've been like, how do we know where to send these patients to and what to do with them? Well, you've come up with a couple of terms that I do want to get into. One is youngering. What is youngering, and how is it different than anti-aging? We know anti-aging well. We're all on that bandwagon and trying to reverse our telomeres and do all that fun stuff.
See, you just said the problem. Anti-aging is not reversing telomeres. Youngering is.
Okay.
The process of making younger. Anti-aging is just stopping you from getting older. Right? So
right. Yeah.
We don't have a term for youngering until I invented it. See, because
Got it.
it actually gets you younger, not just stops aging. Anti-aging is just stopping you from getting older.
I love it. I love it. So how do we go about youngering? We need some advice here. What are you telling us to do? So.
Well, you know, it turns out that you can give stem cells intravenously, you can give them subcutaneously, you can give them directly into an organ. Now, the best treatment is to put the stem cells directly where the pathology is. So wherever there's some damage, you can put the stem cells there, you get the best results. But if you have, like, for example, some of my people come in with joints, the shoulders are bothering, the elbows are bothering, their knees are bothering, their hips are bothering, their toes are bothering, and it's all arthritis. Well, so rather than give them you know, 10 shots of stem cells, we give them maybe 1 or 2 IV, and they circulate and go to all these areas that are damaged. And you can get some good results with everything. And you can do the same thing with the subcutaneous, because subcutaneous just takes about 2 or 3 days longer to get into the circulation, but they get in and you get basically the same result. So I thought, you know, if you get the same result with the subcutaneous shot, why not use those stem cells for facial rejuvenation?
Yeah.
So that when you get the youngering, you get a whole body effect of the cells not only helping fix your face, but also the rest of your body. So we're now offering a stem cell facials, and that's at a really good price as compared to everybody else. And I think that's a way to go if you're gonna do youngering, because I mean, most people can't afford to spend 10 or 15,000, nor do they want to. But I mean, if they have the money and you can spend it, that's great. Then you can do IV stem cells, and you can do it. Now, the way to do that is a special way I've come up with, and that is what you're trying to do when you're rejuvenating the whole body is to get the stem cells into the whole body, and directly into the bloodstream, and that's all. They don't get very much. You know, they measured in rats, I think it was. They did that kind of study. They measured the number of stem cells in the muscles and other different tissues, and it was only 0.05% of the cells were replaced by the stem cells. So not very much by giving lots of stem cells intravenously. So how do you get the stem cells from the blood into the tissues? Well, there's a treatment that we've been doing for many years called chelation therapy. You may have heard of it. And there's 2 different kinds, a disodium EDTA and a calcium EDTA. If you use the disodium EDTA, which is used for treatment of hardening of the arteries, and you give that to a person first in a decent sized dose, it takes away the calcium from the gap junctions in the endothelium of the blood vessels, which opens up the endothelial gaps and allows the stem cells to easily pass through into your tissues. So the chelation first, and then give you the stem cells IV, and then the stem cells are able to pass into your heart, your muscles and lungs, et cetera, et cetera. So you have a lot higher percentage of stem cells circulating and growing in your tissue. So that's overall a generalized anti-aging effect that's done that way.
And then a stem cell facial, how does that work? Is that topical or injected in the face?
Well, it's like microneedling you do, and all these different ways of doing it. We have the younger person under 40 requires less work. So that price is a little cheaper than the ones that are over 40, because the over 40s tend to have a lot more facial problems and not. So, so you do the microneedling, and then you can use the stem cells to rub that in, and then you inject along these lines and whatever, wherever you have any kind of need for volume and getting rid of the wrinkles and all that. You can put in this, we use tiny needles to do that. And it takes maybe an hour and a half to 2 hour procedure.
Wow.
But you wind up, and the stem cells are not like fillers. You can, if you want to, you can put fillers in with it too, but then that's a little more. But the fillers give you immediate results, where stem cells can take 2 months because it takes time for them to grow in your tissues and all that. But they're also circulating throughout your body too, so you're getting effects in your whole body too.
Amazing. And so have you had good results, like equivalent results
Very
to
good.
fillers and things like that with stem cell injectables?
Yes, absolutely. I haven't, I keep trying to find time so I can do it myself. I was hoping to have had done it. But maybe
I get it.
maybe the next time you do it. Maybe the next time you see me, I'll be a younger guy. You say, "Hey, look at this! You're looking good."
Yeah, there you go. And so, are you doing all these procedures in your clinic? Is that where all this is happening?
I have a full-out lab, a clinic,
Gotcha.
lab, whatever.
Gotcha. And the clinic is your clinic in San Clemente as well?
Everything is right here. We have an ocean view. It's a beautiful place, beautiful clinic. We have about 15,000 feet. So it's a pretty big place, but not very busy because I've got a lot of equipment. Basically, it's an equipment storehouse waiting for you to come.
Got it. I want to see it. Next time I'm out there, I want to come visit and check all the.
Yeah, and it's all, I try to design it so that it's all about youngering. It's all about making the stem cells work better. Everything I've got here is for stem cell enhancement. So we have things like a periodic acceleration, which causes shear stress in your blood vessels, which causes increased growth factors. We have external counterpulsation, which causes increased growth factors, and that's for the heart. And it's also, you may not know, but if you think about youngering as compared to young people, as compared to old people, and if you look at an old tree as compared to a young tree out in the winter, the old tree has got very few fine branches, and the young tree has got many tiny little branches. And the same thing is true for the human body. The older you get, the less of these capillaries that you have to supply your organs with. Your oxygen supply is being diminished as you get older because of the loss of the capillaries. And so by taking and doing external counterpulsation, you increase the number of capillaries in your system. That helps your kidneys, your lungs, your heart, etc. And you can do stem cells along with that, and that enhances the formation of these capillaries. Now, there's also functional electrical stem that can do some of the same kind of thing. And by doing this, you increase your metabolic efficiency, which means that you're able to convert glucose into energy better. So that means your energy levels are going up and you have more energy throughout the day and all that. And so those are all good and they all work together. So these are all synergistic therapies. And there's a few more I could rattle on about, but I better stop.
Yeah, no, it's all fascinating. Is it realistic from a price point standpoint for the majority of people to do some of these things, or is it a last resort, or how do you view it in the scheme of pursuing different procedures and strategies to be younger?
Well, everybody has to make that decision on their own. And for example, as an example of what to do, when I was in medical school, I had $600 and I had an old car that needed tires and it was going to take my $600. And I also had a couple bad teeth that needed $600. I chose my teeth and threw away the car. I still have the teeth.
Mm-hmm. Right.
So you have to take what is most valuable to you and take care of it. And this is what we're talking about. We're talking about the very best therapy there is to keep you younger and healthier. I swear to God, you have to understand how important stem cells are. Stem cells control your rate of getting older. If you don't have if you have damaged stem cells, if they're oxidized, if you have a lot of oxidative stress, your stem cells like the telomeres get shorter, the stem cells lose their growth factors and they cannot replicate well. And so between the telomeres getting shorter and the stem cells getting older, you're in trouble. And so you want to take telomerase activators like your TA65, and you want to take stem cells at the same time. Now, sometimes people come and they do the TA65 for a month, and then they come and do a bone marrow. That works great too, because the TA65 makes your bone marrow stem cells younger and healthier too. So that's, which is interesting. So the bone marrow is where most of your stem cells are. And to get them stronger and healthier, number one, you should be out walking a lot. And number two, eating correctly and not having any toxins and avoiding air pollution and any kind of pollutants that have particles in it. Diesel fuel, for example, is terrible. All of these things. Now, another thing is thymus. And thymus atrophy is another thing that's associated with aging. So you combine thymus peptides, hyperbaric, stem cells, ECP, those kind of things, growth factors. We have brain growth factors. So if you have a stroke or traumatic brain injury, we can use hyperbaric, we can use stem cells, we can do brain growth factors, all these different things. There's a whole variety of different things we can choose from to help each individual patient. It's just exciting to have all together in one spot.
Gotcha. Well, it sounds amazing. One last question before we wrap up this youngering expedition here is, can you use stem cells for cancer? Have you used them in the scenario of cancer?
In general, we don't. Some cases now that made, glioma, for example, there's some evidence that it might help in glioma, and maybe a couple other cases. But in general, you want to do it in combination with the chemo or right after the chemo, rather than before chemo. And it depends upon the stem cell too. So if you happen to have access to embryonic fetal stem cells, which we don't have in this country, then that might be of help. But those are hard to come by. There's one place in Mexico, one place in the Ukraine that does that, and you'd have to ask them for their results. But I can't. But there's a lot of things for cancer that we can do. We have a place in Tijuana where if you're terminal cancer, you have a lot of tumors, we can take you down there. They put under a CAT scan, they put a needle into the tumor and put a direct. We analyze the tumor for the proper chemo to give, and we can directly inject the tumor with the chemo, and then no matter how far advanced you are, it'll kill the tumor without any side effects, which is amazing. Because you can't do that in this country because they say, well, you can't take chemo because it'll kill you. Well, in this situation, it won't kill you at all. So that's a really exciting program for those people that are really bad off and don't have any place to go. They should call me.
Wow. Okay. And one last question. I know I said that was the last one. I was just kidding. This is the last one. What are growth factors, and how do you differentiate growth factors from stem cells? Because you see in all these different beauty products and hair products and stuff like that, growth factors sort of advertised. So help us understand that one.
Well, there's genetic engineering involved with the growth factors that are being sold mostly. And I'm not so sure where they're getting them. There was some places in Japan that were making them with the like E. coli bacterial source. They take the bacteria, put the genes for these growth factors in, and then they grow them in vats, and they grow them, and the bacteria secrete these growth factors, and they take the growth factors out and bottle them up and sell them. And they work. And there's I don't know how many. I've been trying to look at how many growth factors there are. And once upon a time, I did a little research study. It was just one project and only one couple cases, but I took umbilical cord blood and measured the 32 different growth factors and found that on the average is like 10,000 micrograms per deciliter in the newborn blood. Then I took a 90-year-old and measured the same kind of things, and I found that instead of 10,000, that 90-year-old had 100. So there's virtually no growth factors in that older person. So you can understand why an older person cannot repair and regenerate, even if their stem cells are good. So what you have to do, if you don't have growth factors, you have to give a lot of stem cells to that older person to get the same result that you do with a young person, because a young person is full of growth factors. And so the older you get, by 40, your growth factors are on the wane and getting down, they're going down, just like your human growth hormone is decreasing. And by 55 or so, your male hormones are going, your female hormones are going.
Right.
Tend to get more symptomatic than men, but men have it too, and up to about 20% of men by the age of 60 have it. By the time they're 65, it's more like 40% of men have testicular atrophy and all these kinds of things. So it all starts to, everybody's got the dwindles after about 50.
Yeah.
This has been shown to be, and get the dwindles at age 52. So everything starts to deteriorate. So I would say if you have the dollars to spend on yourself, you should start spending them on yourself at about age 50. And so get some good testing done, figure out what your optimum levels are, and, or even earlier, the earlier you are to get these optimum levels for you. What is your optimum testosterone? What's your optimum estrogen? There are all these different things you can do to measure what is your level, and that's what you should shoot for to keep it going at that level. So that would be that way in the next 10, 15, 20, 50, 100 years, you would have, back when I was 21, I had this. This is where we should be going for. You see what I'm saying? So you
absolutely.
Try to maintain that optimum youthful body and spirit.
Yes. Well, it sounds like diet matters, detoxing matters, hormone balancing matters.
Yeah, talking about detoxification is very important. The newborn baby has got virtually very few toxins. Even if you measure, they've got like very trace amounts of like 90 different toxins. We don't want those either, but they're a lot cleaner than the rest of us.
Mm-hmm.
It's been my understanding from what I've been seeing and reading and doing is that the human body has many toxins. We have airborne toxins, we have diesel fuel toxins, we have toxins in our body from meat. We have this, trimethylamine N oxide, which is a toxin that comes from the metabolism of meat that causes cardiovascular disease and whatnot. Also is a marker for gut poisoning. So gut toxins cause this formation of this poison, and you can measure that in the blood test. And now LabCorp and Quest both offer it, which is great. So you can test to see if you have that toxin. And then you can also do like an oats test for your urine organic acid test. You do a stool analysis for all the different bacteria. And the point of it is that there are things called gut-derived microbial uremic toxins. And these gut-derived microbial uremic toxins are poison. And they interfere with the healing of the body, especially if you have kidney failure. And so that's how we discover them, because the kidney patients that I try to treat with stem cells, the stem cells didn't work on. And I came to the conclusion it was these poisons that were causing that. So if you happen to have those same kind of poisons, your stem cell treatment may not work for you. And so it's, again, something we need to think about. If you fail, like I had a patient in here just now who had a failure of stem cells on his joints and everything. And so we're testing him for that kind of problem. Heavy metals can be a problem. So lead, mercury can be a problem. It can keep you from getting better. It keep you from, make you older faster. Lead makes you older faster, so and mercury does. They all cause oxidative stress. COVID makes you older faster because it causing you oxidative stress and making you older. And it causes the telomeres to get shorter too. So and so stress is from anything that causes your adrenaline to flow a lot. So if you're always chronically worried about things, your adrenaline is chronically flowing. And what that does is causes the formation of hydrogen peroxide in your tissues, and that's very stressful. And we know it also causes white hair. So when you get immediate, those cases where people get scared really bad and then their hair turns gray overnight, that's because of the formation of this hydrogen peroxide in the hair follicles. Opened that and discovered that back in the 80s, I think. But nobody ever picked it up here in this country that happens.
It's fascinating. Oh my gosh, I could talk to you for probably another hour about all these concepts. I think this is so interesting. I definitely want to come see your clinic and see what you're doing. I would love to
have it. Anybody wants to come, I'm happy to give them a tour.
I would love to once we're kind of back to normal here. But thank you so much for taking time out of your busy schedule to join me today. If people want to learn more about your work and what you're doing, what's the best way for them to connect with you?
Well, strokedoctor.com is a good place to start. There's a place you can write questions and ask questions. Stroke Doctor, just like it sounds, STROKE doctor. Don't send your failing husband over here for repair of that stroke. But I got that name many years ago, and because of its historical use, it gives me a better placement on Google.
There we go.
So I have other names like stemcellmd.org, but
Yeah.
it's a newer one, so it doesn't give you as much power. So I went back to my stroke doctor so that I get better placement on Google. So that's kind of a remnant of my days doing stroke therapy. So that's and I'm just trying to make sure everybody can hear and see me. That's all, because it's
Absolutely.
kind of a lost little Mohican in the woods over here, because I haven't written any books since 2006, and I'm not on the lecture circuit, and I don't put out videos all the time or anything. I'm always working on coming up with new things for people.
Well, I mean, your work is obviously appreciated and needed, and it is hard to balance it all and get that message out there. But thank you for sharing some of your time with us today. I know I've learned a lot. I'm sure everybody else listening has learned a lot about stem cells in the future and growth factors and youngering and so much more. For everyone watching this episode of Superwoman Wellness, thank you for taking the time out to join us today. And remember, we're on Apple iTunes and Spotify as well. So rate and review it and share it with your friends. I will see you guys next time.